Is snoring a serious health problem?
Things which we need to realize and understand: when we sleep, a middle-aged person or an elderly person snores, we think about the noise coming and we try to ignore it and get used to it. But it's not the noise which worries us as a healthcare provider. It's the apnea, it's the blockage which actually worries us. So what happens when we sleep? The body relaxes, the muscles relaxes, and particularly what we call the palate, the muscle on the top of the mouth along with the uvula and sometimes the tongue. So when these muscles they get relaxed, they tend to fall back, and that is when your air passage becomes or starts getting blocked. Now this is what is worrisome. So your windpipe or your air passage, when it starts to get blocked, that means the oxygen levels are also getting blocked. So it might be a 10% decrease from normal. So instead of 100%, you might be getting 90%, or it may be even severe like 75-80%. So imagine every night during your 6 hours or 8 hours of sleep, the body receives less than normal oxygen. So due course of time, say 5 years, say 10 years, that is the time when you start feeling those problems. Now what problems can you face when you have something called sleep apnea? One of the most common things seen is excessive daytime sleepiness. You woke up with a heavy head, you don't feel fresh after a good sleep, you thought so. In the morning, when you are waiting alone, say you are traveling to some distance, you tend to fall asleep. But what is more dangerous, suppose you are driving alone and then you might even fall asleep while driving the car itself. So this is one of the very commonly seen situations. Then of course you have got fatigue, mental irritation, heaviness of head, headache, which is very common. The other thing to look at it is when the oxygen levels are less, the heart is under a lot of stress because of the low oxygen content. So what happens is you start having cardiac problems, and one of the most commonly seen is hypertension, which doesn't get easily controlled with medicines. People who are diabetic, that is your high blood sugar, their blood sugar level doesn't come to normal easily with medications. And of course, if it becomes very severe, even an heart attack is also quite possible. These are the reasons why we try to stress, we try to create public awareness that don't neglect snoring or your sleep apnea.